Hello everyone. Today we are going to see about the genetic testing in neonates, where a subtopic which we'll be seeing in this session is developmental delay. So developmental delay is mainly affecting the child's fine motor or gross motor, or might be the emotional, social, or even the sensory inputs being impaired, such as hearing and seeing. So in this, the child will be either showing in early signs, early warning sign in the early stages, or might be it is high hidden in some of the children where we screen and find out that the child is being suffering with developmental delay. So the introduction of the developmental delay before going into the abnormal process, let us see what is the normal development. Humans develop through a dynamic sequential process since the early days of life as embryo, and the process continues soon after birth as well. So this is explaining that the human is going on with the early stages, such as from the fetal life till the birth, or even after birth the development is going on in an aspects. Like for example, olden days we were using only small mobiles, which is touch only with button. But nowadays we are exposed to the Android mobiles as well. Similarly, the development of the children also is not staggering behind. It goes on a dynamic process. So, in this aspect of developmental delay, the child is not able to reach the developmental milestone as per the expected age. For example, if the child is being diagnosed with developmental delay, either the fine motor or the gross motor or the social or might be the interaction with the environment as well as the parents are totally reduced. So only we have given here, if it is like more than two domains are affected, then the child can be diagnosed with developmental delay. So, what is the definition of developmental delay? So, developmental delay is a significant lack in a child's physical, cognitive, behavioral, emotional, or social development in comparison with the norms. So, the norms here describes the age of the client. For example, if the child is 10 years old but still having the mental capacity and the development of around only age of 5, which shows that there is a significant lack in the cognitive and the behavioral aspects as well. So here this developmental delay, the major risk factors behind is that might be either due to genetic or environmental factor. So genetic is purely due to chromosomal defects such as either the aberration of the chromosomes is extra or might be it is decreased. Environmental factor, which we'll be seeing in detail, what are the major causes such as if the mother is not having proper nutrition or might be totally exposed to many toxins, or might be during the pregnancy period the mother is being exposed to TORCH, that is the toxoplasmosis other rubella congenital herpes simplex viruses. So these factors will be a major role for developing the developmental delay. So we will be seeing in depth of what are the environmental factors, such as I told you earlier, it is mainly due to the exposure of toxins. The toxins might be either through alcohol consumption, opioid consumption, or any drug consumption, such as marijuana, which is drug abusers. And if the mother is being exposed to any lead toxicity, there is chance for developmental delay. The baby can be born with premature birth or low birth weight baby, and you can see that the mother is also being exposed to many other infections in the previous period, or here the child can also have severe trauma. So, what will be the early warning sign of developmental delay? There are different warning signs. As I told you, it is covering all the aspects of the child development. So, the first aspect which we are going to cover is behavioral warning sign. So, the child won't be able to pay close attention, and there is no focusing, like they'll be either focusing to a normal object for a long time. Like, for example, if they see our hands, they'll be seeing our hands for a long time, and they avoid contacts, eye to eye contacts. They are not able to do simple tasks. They become very aggressive and they show violent behavior as well. So the next warning sign would be gross motor warning sign, which like they'll be exhibiting all these symptoms related to the arms, legs, limb postures, and either the bodily postures or might be they show some sort of different aspects, like clumsy manner sitting in one area, and they are behaving like they are fixed to a particular posture for a longer time, or might be they need assistance for a longer time. Either rigidity or floppy can be seen in these warning signs of developmental delay in gross motor. The third warning sign would be vision warning sign. So here the child will be exhibiting all the ophthalmological symptoms such as difficulty to follow the objects, that is eye to eye contact. Frequently the child will be rubbing both the eyes, and might be the child is turning the eyes or tilting the head, or holds the head for a unusual position for a long time, like might be folding the like hyperextension or lateral flexion, or might be right or left lateral flexion. And the child won't be able to find out all small objects, they won't be able to hold in hand, as well as they are not able to maintain good eye to eye contact. And the hearings warning signs would be like uh, they'll be very louder, or might be very very softer, but that is either they shout with arrogant and aggressiveness, or they are very soft, that is we don't know whether the child is there in that particular house, like that they are very mute, and difficulty in responding when you call them by their name, and also they are not able to understand our directions, and the ears will be appeared very small, or either it is deformed or malaligned, which shows that it is also a major developmental significant changes in the developmental delay. So, how we can screen these developmental delays? So, they can be either screened by these three inventory tests, such as Batley Developmental Inventory, Bailey Inventory Neurodevelopmental Screening Test, Minnesota Child Developmental Inventory, where we'll be seeing in the further slides on how they will be doing the screening for each inventory scales or inventory test, and they will be finding out the inference for each inventory test, which will be seeing one by one in detail. So the first would be Batley Developmental Inventory Test. So in this picture, you can see that it is composed of many minute objects, some creativity to identify whether they are having good fine motor or gross motor function intact. So it is a preset recording where it will be covering about the adaptive demand of the child, the personal and social aspects, how is the communication of the child, the motor and the cognitive aspects. So this can be used for children from 12 to 96 months, and here it is a direct observation method, and here also we can include the parents also during the inventory scale usage. And the next inventory scale where we screen for developmental delay is that Bailey inventory neurodevelopmental screening test. So this test also it starts from each month, for example 0 to 3 to 4 month, 5 to 6 month, and 7 to 10 month. Like that they have divided into groups, and they find out what are the fine motor and gross motor or hearing or social impairment is there. And this can be administered for the child from 3 to 24 months of age, which shows the changes in the developmental delay. And the last one will be in screening test would be child developmental inventory Minnesota. So this consists of around 300 item book list, and it is like a booklet type where the parents are allowed to record the results. And this is a systematic as well as standardized method for analyzing the child's strength, what are the problems the child is undergoing at the current situation. And this test will be covering the eight major areas, such as how is the social development of the child, is the self-help, that is the baby or the child able to do their own activities on commands or by instruction. And the next two will be Denver Developmental Screening Test. So this is a screening test where it combines of around gross motor, fine motor, adaptive language, and personal and social development. And here the criteria or the questionnaires will be around 125 items, and this combines either the child is also directly observed in the study to identify how is the personal as well as social development, and the parents are also being interviewed to find out onto which the developmental delay is lagging behind. So first we saw what is the cause, what can be the possible the screening test. So coming to the intervention, so here it is not just by like the normal medical surgical conditions where we give drugs, but here we have to go for deep counseling and training for the baby as well as for the family. Educational programs can be implemented, medical services can be rendered, and nutrition services according to the child's feeding pattern. Here we also give in total importance to the occupation and physical therapy, and majorly we go in for the psychological therapy. So coming to the educational programs, how we can start training the child. So it have certain strategies. So we have to plan certain strategies and place the child undergo all these strategies. Like starting with teaching one skill at a time, simple games or activities can be given to the child, or might be you can institute the child into a small group or one-to-one instruction according to the level of understanding. Plenty of opportunities for practicing the skills, and you can use the assistive technologies. Either you can integrate the academic concepts into the lessons, and you can also use the recent trends. So to summarize, there are ways to make progress for developmental delay. So we can ask the parents to play with their child, read with their child, limit the screening times, and make a proper schedule. Like a timetable should be planned, and always whenever they need any emergency or they wanted to seek the healthcare worker, they can have the contact number and immediately inquire the doubts, or they can come in person to the hospital itself and find it what it can be done for that particular behavior. So, to conclude, children with developmental delay are at risk for developing intellectual disabilities as well. So, intellectual disabilities is that they are very poor learner. So, it is not that we have to give a social stigma and put them aside. Instead, we can call them as a challenging child, where they'll be able to learn the skills, or we'll be able to train the child by daily communicating and daily interaction and giving strategies. Like we plan strategies to the child and give the treatment to the child. So like to end up by the end of this video, you will be able to define what is developmental delay, discuss the possible list out the possible risk factors for developmental delay, and the warning signs, that is the emotional and the yeah, that is intellectual warning sign, and the social warning signs and all. And you will be able to also enumerate the screening inventories for developmental delay, and you will be able to describe what are the interventions to be planned for a child with developmental delay. So, if you have any further doubts or inquiries, definitely please put it into the comment box. And here are certain references where I have gone for the developmental delay. You can also go surf the net and find out more interesting ideas in developmental delay. And there are many other inventories which are still in studies, and they are putting into practice to screen the specially child the developmental delay, and how we can prevent, what is the therapy we can give for this child can be planned essentially. And if you have any doubts, please put it into the comment box. Thank you for the listening, and please don't forget to like and comment and subscribe my channel. Thank you for your patient listening. Thank you all.